Welcome back. Today we're going to be working on the anterior cervical. So one of my favorite ways to warm this region is just right below the clavicle. I like to take my blades of my fingers, the outer blades, and just sink in right below the clavicle and then sink down and scoop the pecs and the breast tissue. And then can very gently get my lotion around in the cervical region, and then I'm going to scoop my hands underneath with some traction. And when I turn the head, I always like to support the head behind the neck, give a little traction while I turn it. And here, the anterior cervical region is a very small area. It essentially borders the superior angle of the clavicle, the SCM, and if you can't quite see or you're not sure where the SCM is, ask your client to lift their head ever so slightly and it pops. You'll see how it pops out very nicely right here. And so you have your SCM, you have your anterior, middle, posterior scalene, and then you have your upper traps right here. You can see they're just kind of laying down very nicely on the table. So this is our anterior cervical region. It forms a triangle. And how we're going to warm that is simply to sink our broad fingertips down and start from right below the ear, the origin of the SCM all the way down. And then I'm going to move laterally to hit all of the scalene muscles. And I'm going to take those all the way down to the clavicle. The scalenes attached to the ribs underneath this clavicle. So I'm going to take my fingers down and follow the scalenes as far as I can. So after a few of these nice strokes where I'm just going to the depth of the muscle tissue below, I can feel an area of tightness and it seems to be centered right around here. So now that I've warmed this area, I have assessed and determined where the area of most dense and tight muscle tissue is. I can take and slide my fingers underneath, rotate her head slightly back, and then I can find that spot with my thumb. And this is a little bit of a treatment here. We're going to, again, treat this with some static compression, but we're going to add a little bit of positional release. We're going to shorten this muscle. So once I get right on that tight spot, I'm going to confirm with my client I'm right on an area here. And then I'm going to just hold that with my thumb, that pressure that gets her attention. That hurts so good pressure. And then with my headward hand and my fingers in the back of the posterior cervical, I'm just going to slowly rotate her head towards the area of work, towards the muscle that's tight. And then I'm going to hold that pressure, direct sustained compression or pressure right on that spot for about another 30 seconds until I feel it start to soften, which it will. If you're patient enough, you'll always find a change in the tissue. It may not completely release, but any release is better than nothing. And I'm just moving my thumb down a little bit further because I'm feeling some more tense areas, tight areas right in through here. This is most likely on her anterior scalene. And also this area can feel a bit uncomfortable when it's really tight. And sometimes they can feel sensations down their arms. So I ask them to bend their arms like my client is doing. They can bend their arms on their belly, and that will decrease those sensations if they have any going down the arms as nervy sensations. And then of course I can come and pinch the upper traps from the supine position, which is also very nice. So a thumb, you want to make sure when you use this thumb that you're keeping it in a sort of claw position so that you're not hyperextending. We want to keep our thumbs safe for longevity, the longevity of our career. So if you need to, you can always switch it back up and use your stiff fingers. And then you can also take and use a kind of a loose fist, which is a myofascially type of move. I've got lotion on, so it's not a true myofascial drag, but I don't use much lotion for that very reason, that you can do some of these nice myofascial type drags if you don't have too much lotion on. So just taking your loose fist and sinking in and keeping it nice and loose and contoured as I scoop down around towards her posterior cervical and upper traps. And then when I'm finished, I always like to finish with some nice traction. My hands, I'm going to show you where the work is being done, but the neck, I scoop under the neck and I'm squeezing with my thenar eminences here and leaning back and providing the traction that way. So one hand, scoop the other hand underneath, squeeze with the palms in my thenar eminence, and then pull and traction. And I'm just leaning back. So here are some nice techniques to get you started on that anterior cervical.